Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. Let's just run through, what your NRP program is like and, the logistics of the program.
Yeah, sounds great. So we hire nurse residents twice a year. We hire usually a summer cohort that's generally May graduates, but sometimes we'll have people that have graduated in December and wanted to take the time off and study for NCLEX, things like that.
Mm-hmm.
But we'll do a January cohort and then a May cohort. And so we have two really hiring cycles that we hire into. We do all our interviews, then we bring them in. They have the same onboarding day, every single one of them. So from day one, they're having the same, anxious onboarding nerves, what do I wear nerves, kind of what's that like. And so they all get that the same day. We spend their first 2 weeks really doing some hospital orientation. We do all the normal hospital processes that you have to do HR-wise, onboarding. And then we spend a whole week of doing nothing but NCLEX study time because a lot of times, a lot of these nurses if they graduated in May, they're onboarding in June, and they haven't had that dedicated time to really devote to it. And I love that we're able to provide that for them. And so we say, take everything off your plate. Don't want you to do anything this week except study for NCLEX. And we provide some sort of structure around it, and that's varied and changed based on what we've seen worked and what hasn't worked. But we usually give them independent study time, but then we'll also introduce a couple different activities that will really help with knowledge retention and connecting the dots. So we'll do some gamification. We do NCLEX Jeopardy. We play some different games with them. We always do fun breakout stuff to change the pace and let people's mind rest. We do a really funny rendition of Minute to Win It, which is hysterical to watch. So we make it fun, and we also make it dedicated so that they can really focus on NCLEX study.
I love that. I love that the program starts even before they become RNs.
100%. Yeah. That's one thing that we changed as well, because we felt like we were losing people because we were waiting to onboard them until after they had passed. But state processes take forever sometimes. And we hire about 60% of our nurses that come from outside of the state of Tennessee. And so then they're going through the California Board of Nursing or the Texas Board of Nursing, and that can be even more logistically challenging. And so we were losing all these great candidates because we couldn't onboard them. So we decided, let's get them in early. We created a new job description for them. And then the only next step was we needed to get them to pass NCLEX. And so we said, let's dig in and let's help them get there. So that's what NCLEX Study Week is all about, and it's been great.
Amazing. Oh,
yeah.
That's awesome. Have you had instances where, it has been difficult for nurses because of the boards, like there's a gap time in between when they can start?
Yes. Well, so now that we onboard them before they pass NCLEX, they just have to have graduated from nursing school and show proof of graduation. So we have had some states that do take a really long time to get their authorization to test. We give them roughly 100, I think our state law in Tennessee is 180 days in order to pass their NCLEX. But that has varied and changed also with COVID, restrictions and processes have changed. But we follow our state regulations, and if we're getting down to the wire and they haven't gotten their authorization to test, we do often help them. If it's the Tennessee Board of Nursing, we'll reach out to our contacts there, or kind of do whatever we can to help make the process more efficient.
Yeah. Oh, that's really nice. I remember in Virginia, at least it was like 6 months or something, just wild.
Yes. Oh my gosh, it can be crazy. And that's something we take into consideration too, which is why we have a longer period that we will allow them to stay employed before they have to pass NCLEX. But yeah, we take all that into consideration, and we really want to support our new graduates. And unfortunately, that's something that a struggle that they're going through. And so we want to try to help as much as we can.
Yeah, amazing. Okay, so once they pass their NCLEX, what's next in the NRP program?
So we have NCLEX study week, and most of them, if they haven't tested before now, they'll usually test at some point over the next usually 40 to 60 days. Okay. And whenever they get their authorization to test and then they schedule, they just let us know and we allow them that testing day. But after NCLEX study week, they go through a series of rotations, and this is what we call our clinical rotations, where they'll rotate through pretty much every single nursing area that we have here at St. Jude. They'll learn the patient populations, the flow of work. They'll meet the people. They'll work a variety of shifts. They'll work inpatient, outpatient, 8-hour days, 10-hour days, surgical services, get to see inside of an OR. Mm-hmm. And so they really get to see what type of nursing environment I want to work in, what type of people I want to work with, what type of patients I want to care for. And that's really, during that first 6-week period while they're doing this, we don't want them to have to focus on learning different nursing skills. They'll pick some up just through the process, but we want them to really focus on where do they want to commit their time to. Yeah. So they'll do the clinical rotations. At the end of that, we have them submit their preferences on where they'd like to work. Then there's usually, because we have to run it through an algorithm and match and all that kind of good stuff, there's a little bit of a lead time between when they have their preferences are due and when we have match day. So they'll do what we call an ancillary rotation week, where we schedule a lot of different experiences for them that they probably wouldn't normally see at their first part of nursing. And it really gives them a greater appreciation for the different types of things that we do at St. Jude and kind of a back end look at what's going on behind the scenes. So they might spend the day in the lab with a laboratory technologist. They might spend a day in the blood donor center. They might go with a research nurse and see what the really research side of nursing care can look like. They'll spend a day with a CRNA or a nurse practitioner and kind of give them a glimpse of what other types of careers look like or people they may interact with. Yeah. With the hope that it will give them a really good understanding when they go to the bedside and and a lab gets returned because it's not filled all the way or something like that. They're like, oh, I sat there and got to see that side of it, so I know how important that is. I love that. I think that that's so important for any orientation to have. And that's so easily implemented, I think, to have a week where you get to understand the different system processes in the hospital so that you understand, like, okay, yeah, this lab is going to take 10 minutes, but this lab is going to take an hour. And like, I have to do this one first. I mean, and there's so many things where you feel like maybe that's not, why is this important? And then you actually get to see behind the scenes, like, this is why would they do it a certain way. 100%. Yeah. And they get that too throughout the clinical rotations as well, because we place residents in all of our nursing areas. And so when they get to rotate through the OR, but maybe they work in an inpatient unit or end up matching there, they know all of the ins and outs of what goes into that patient when they're in the OR. So they'll probably do a better job doing their pre-op checklist or recovering the patient because they've seen that backside of it. So it creates a lot of really good connections too. They might not be nervous giving a report to somebody else because they've actually met that person before and talked to them. Right. So there's so many benefits that we've seen of giving them that really in-depth look into everything that goes into caring for our patients. So it's a process that we really like and modify as we go.